Hi everyone. So good to see you. To start, all good with my slide? Great. Thank you for that beautiful introduction. So yes, my name is Megan. I'm a second year doctoral student at UCLA in community health sciences, where a lot of my research right now is focused on maternal child health among agricultural workers, mostly focused in Central California. But like Alexis mentioned, I collaborated a lot with NCFH during my time at Health Outreach Partners. So it's just really an honor to be invited back, because they do incredible work. So always to support them and to support the agricultural worker community. So today, I'm going to be talking about mental health among maternal health. And so just we have three main objectives here today. The first will be to describe key maternal health challenges affecting the agricultural worker community, including barriers to accessing prenatal and postnatal care. Second, to explain the importance of screening for postpartum depression, including recognizing common signs, risk factors, and its impact on maternal and infant health. And thirdly, to identify practical strategies and recommendations to improve access to care, as well as increase mental health support for pregnant and postpartum pregnant individuals in our communities. So I won't get too much into the agenda, which I just mentioned, because I really would love, I have the chat open. I see some of you, I can't see any more of the participants, but I have the chat. But I would love for you while I'm, talking is just to kind of introduce yourself, maybe your name, your title, where you're coming from, and what you're hoping to get out of today's webinar. I would like this for to be kind of an informal session. So if you have questions throughout the chat, or with throughout the session, please put them in the chat and maybe I can get to them. But like Alexis mentioned, we'll be having a Q&A at the end of the session. But just in case anybody wants to participate or add something in their own experience. Okay, so before we talk about postnatal care or mental health, we really need to talk about the importance of prenatal care and why that matters. So, prenatal care is essential to identify risks and address pre-existing conditions such as gestational diabetes, preeclampsia, that poses health risks for both the pregnant person and their fetus. Back in 2023, 1 in 14 infants were born to individuals who received late or no prenatal care, and 1 in 6 infants were born to those who received inadequate prenatal care. In California specifically, the percentage of infants born to those who received late or no prenatal care rose. And this is something that can be prevented as early, consistent prenatal care visits helps allow with screenings and health education to help reduce preventable outcomes like preterm birth. Um, and this is especially difficult in rural communities, those without access to healthcare, but it's definitely significant. So, what is it? Prenatal care refers to the medical and supportive services provided to pregnant individuals throughout their pregnancy to ensure the health and well-being of both the mother and the developing fetus. Um, so some purpose among this is to monitor health of the pregnant individual and the fetus, to identify and manage potential health risks and complications, provide education and support on maintaining a healthy pregnancy, as well as, provide planning for childbirth of where that individual is going to go for childbirth, as well as starting to plan postpartum care. These components include, just regular monitoring of the fetal growth and development, medical checkups, seeing of blood tests and screening, testing for STIs, things like syphilis, immunizations, nutritional counseling, and guidance. But also, very importantly, and often neglected, is this emotional support and stress management. So, regular prenatal visits really help identify mental health concerns early. It's a time where the patient and the clinician or the outreach worker is able to talk through these things because mental health affects your sleep, your nutrition, your just overall pregnancy health, and providers are there to help offer screenings, counseling referrals, and support resources, as well as encourage or help that person find, emotional support groups, support systems from family and friends. But also, I think most importantly, is reducing the stigma, encourages pregnant individuals to seek help when needed, to recognize their mental health, to support healthy coping strategies like rest and stress management. And this should all be included as an essential part of pregnancy care. But that's also very difficult, especially when we're thinking about migrant, seasonal, and agricultural workers who are already under immense stress and already have significant barriers. So I'm curious if anyone in the chat can kind of start to think or brainstorm of what do we think are the biggest barriers to prenatal care for MSAWs? Gonna just take a couple minutes, see if anyone's in the chat. No worries. Okay. So, yes, access, insurance, all important transportation, decreased coverage due to legal status, all right on the nose. So, I've conducted some research last summer looking at the barriers to prenatal care among agricultural worker families because I think oftentimes when we talk about the agricultural worker community, um, there are pregnant individuals who do work in the fields, but the majority of this worker demographic does identify as male. So I like to just increase this when talking about agricultural workers. I'm talking about their families too, because, oftentimes they have, families at home who may not be working in the fields but are pregnant. So, um, these are some of the main barriers that when I was talking to key stakeholders is one, transportation. Someone mentioned it in the chat. It's a huge barrier for agricultural workers as sometimes health centers are far away, but also they just the access to health centers and maternity care deserts where there's not hospitals available in counties and people needing to go outside of their county to find prenatal care can be a definite barrier, which includes geographic isolation. Um, Also, OBGYN access and availability. So, a lot of times when I was talking to stakeholders, they were saying, we just have limited availability of these OBGYN services. And on top of that, maybe there are some. available in the community, but they don't take Medicaid, or they don't speak Spanish, or for many indigenous communities, Spanish is a second language. Financial and lack of insurance. I know here in California, um, Medicaid or Medi-Cal allows undocumented folks to apply for health insurance when they are pregnant and after 1 year of pregnancy. But I know that's not the case for every state. So that can be a big barrier. And last but not least, stressors. This is a very stressful time for this community. So understanding and being empathetic and meeting this community where they are is will really help bridge the gap between the community and prenatal care. Just going to take a look. For example, some people from some countries of Central America are not the same. Yep. We have people from countries that they live in villages and rural areas and follow a lot of their ancestry. Yes, this is also something that I'm looking into. And I think it's important for all the health centers to be aware of that, from the current situation that's happening right now, health centers and counties are seeing a decrease in prenatal care access. And so I think the hardest thing will be to really find these communities that are, number one, may not want to go and access prenatal care because they have their own um, ways of conducting maternal health. It's a very spiritual practice. It's a very community driven. So I think that adds definitely layers to this very complicated um, issue. But when we're talking about these unique stressors too, and I say this with a wink, is that, this current community is facing a lot of fears and uncertainties that discourage them from seeking essential health care, including prenatal care. These challenges are leading to delays in starting and less frequent prenatal care, but we know that timely and routine prenatal care remains crucial for healthy pregnancies and better birth outcomes. Um, because we know the consequences. So I think in general, stress can worsen the initiation and delay the frequency of prenatal care. So we can assume that because this is a stressful period on this community, people who are pregnant, it's an added stress and worry on top of all those barriers you saw in that little diagram. So, looking at my research and what I was kind of trying to find is how just first to understand the problem. And so I found that, there's limited options in rural areas, few clinics nearby really make it hard to get timely prenatal care. Some counties in California don't even have birthing hospitals. So, just making health center staff aware of some of these issues. Um, Preferred language is difficult when many of this community where their second language is Spanish makes communication very difficult, as specifically when it's not a written language. And so, really trying to create health education materials and increasing awareness can be difficult when, a indigenous language is more oral versus written. Um, the geographic isolation, hearing some of the delays and visits or even considering home births. But again, we don't have that data, especially in California right now. So just something to be aware of that, as people turn away from formal healthcare settings, they often turn to their informal networks. Um, and like someone mentioned in the chat, they, follow a lot of their ancestral traditions and get support from their community. Um, some of the same, but just this is a big problem amongst agricultural workers. And I know we're talking mostly about postnatal, but really just to hammer the point home is that prenatal care is kind of that first initiation into the continuity of care. And so this is where mental health starts. And that's more for the awareness, the talking about coping skills, defining support systems so that when postnatal comes, the clinician and the patient are more equipped and ready to discuss mental health issues. Okay, so looking at postnatal care is starts immediately after childbirth and generally lasts 6 to 8 weeks. More than half of pregnancy-related deaths occur in the postpartum period, and 12% occur after 6 weeks postpartum. I would say that the majority of, if prenatal care, what I'm going to say is if prenatal care is not often attended or is not well attended or there's a late initiation, often postnatal care gets swept to the side, although it's a very critical, important aspect of the pregnancy journey. What is postpartum depression? So, postpartum depression is a mood disorder that can occur during pregnancy or after childbirth. It is more than baby blues, which are short term and mild, and it can develop within weeks to months after delivery. It affects emotional and cognitive as well as physical functioning of the individual. But we often see, oh, there we go. We often see this description of baby blues versus postpartum depression. So what's the difference? Um, Baby blues are often, mood swings, crying, irritability. It begins in the first few days postpartum, and it usually improves within 1 to 2 weeks. It could last longer, but these are just kind of what clinicians say is, just kind of the mood swings, the crying, as hormones are kind of all over the place. But the difference is postpartum depression is a clinical diagnosis with symptoms that last more than 2 weeks or they worsen over time. It's persistent sadness or hopelessness. It's often described with difficulty bonding with your baby. There's a loss of interest or pleasure in activities, and it may interfere with daily functioning. It could affect sleep and nutrition, as well as, again, the bonding with your baby and child development. This is so important because it affects maternal health and functioning. And like I said, it can interfere with infant bonding. The first 3 months of life of a child is one of the most important developmental stages in an individual's life course, particularly that first year. So, if a pregnant or a postpartum individual is experiencing postpartum depression, this often has negative consequences, not just on themselves, which is extremely important, but on their infant and their family. It's associated with poor sleep and nutrition. It's reduced ability to attend medical visits, which becomes a cycle. Um, it increases the risk of chronic depression if untreated. And again, it can impact the infant development at an emotional, cognitive, and behavioral level. So, one of the most important things that we can do is to screen for postnatal mental health. But are people doing this? So, I actually have a colleague at UCLA who did this study, which was to examine who receives postnatal mental health screening at an academic health system in California, which is UCLA. So at UCLA, which is, the what you might think as the gold standard of a health system, are they actually screening patients for postnatal mental health? And this study matters because in California, the law requires mental health screening during pregnancy and postpartum. Um, and even with screening requirements in place, not all patients are being screened equally. So, some of the key findings of this paper were that 67% of patients completed mental health screening during pregnancy, which is not great, and only 56% completed screening postpartum. So, it goes down. This means that a large percentage are still being missed, especially after delivery. There was a follow-up study, which I think is now in the works of being published, but they actually talked to clinicians, OBGYNs, nursings of why screening is not happening during postnatal or during pregnancy or not happening during postpartum. And actually a lot of the responses reminded me of it's just some of the same issues that I saw when I worked with NCFH and when we worked with outreach workers or health outreach partners and we talked about screening for social determinants of health. And, ideally, all community health centers are screening for social determinants of health, but there's a lot of challenges to that. Number one, um, what if you screen for mental health or for social determinants of health and you find out that someone is really struggling with postpartum depression, but you don't have any referral system, clinicians say they feel guilty providing these screenings and not actually having the support or help for these patients. So they're like, why would I screen, tell them they have postpartum depression, and then, say, okay, well, that's great. Well, you have postpartum depression. I'm just going to leave you with that and, you know, maybe never see them again. So I think this is a systemic problem of even if a policy requires mental health screenings, are they actually being implemented in real world scenarios, in real, health centers, in the communities, in rural areas with limited resources, limited time, limited staff, and limited resources within the community? So I think um, what I can take from this and what we should all take from this is that, what to look at your health center or where you are, recognize the support in the county or in your community of where if someone comes with, mental health concerns during pregnancy or postpartum, what is the support that you can give to this patient and kind of create a plan that is proactive in case something like this happens. So this is particularly relevant for agricultural worker communities, um, because they have higher exposure to stressors. Not only is there financial instability, geographic isolation. Sorry, there is an ambulance in the background that I don't know if you can hear it, but it's the times we're living in, I guess. But so geographic isolation, often in rural communities, limited childcare and support systems, language and reduced healthcare access, lower likelihood of consistent postpartum visits, as well as greater risk of undiagnosed or untreated postpartum depression. Um, And another, kind of why screening matters in agricultural worker communities, because you kind of start the issues or the barriers or the challenges kind of start snowballing and coming together because oftentimes when we talk about mental health within this community, it's often different than when we talk about, mental health within, a different minority group. There's often um, descriptions or, just words to describe, depression in the Latina community, like nervios versus something else, or not everyone's always going to come out and say, I think I'm depressed today, or I think I'm feeling depressed. So it's really trying to have that cultural competence, and training amongst staff of like the warning signs, recognizing, having that conversation, as well as screening and making sure our screening tools are adaptive to this community. Someone mentioned because of the language barrier, which is also really critical. And so, how can we incorporate or advocate to have, translators or, uplift health center staff that are bilingual, or even incorporate, doulas or community health workers or promotoras who are often coming from that community and integrating them into care, which is a whole other topic of conversation. But what I really want people to get out of this webinar, is that screening should be universal and consistent for all patients. It's not always the reality that that happens, but it should be universal and consistent for all patients. Patients who appear low risk or may seem like they have it all together, they may still experience significant mental health concerns. And missed postpartum visits can lead to missed opportunities for screening and interventions. Staff play a really important role in normalizing mental health conversations and reducing stigma. So just making sure that we're having these conversations within your staff meetings, with your OBGYNs, with your clinicians, to make sure that they're having those conversations. And if they don't have time to have those conversations, who are we bringing that patient to? Who is that key person to have conversations? Maybe a social worker, or if you don't have a social worker, who can be that point person in the community health center? um, Implications for practice. So, really integrating screening into routine prenatal and postpartum workflows. Is there a checklist for these workflows? How can we really keep people accountable, clinicians accountable, to make sure those screenings are happen? And ensure screenings are available in multiple languages. And perhaps with Indigenous languages, maybe it won't be written, but maybe there's a translator there who can help support that screening. Using electronic medical record reminders and standardized protocols to, one, make sure there's screenings, and two, to follow up with patients who are screening positive for postpartum depression. Um, I think that's important. And screening at multiple time points, not just once. So that's why screening during pregnancy, so prenatal care, as well as postpartum care, is important to see if there's any disruptions, if there's any changes. Um, and this is probably the most important thing, is to strengthen follow-up and referral systems for patients who screen positive. This can probably be said for a lot of different things, but I think especially for mental health, and what we heard clinicians tell us is that I feel bad, or nurses tell us that, they feel bad screening for mental health because people have postpartum depression, but they have nowhere to go. They don't have the financial stability to afford mental health care. They don't have health insurance, or there may not just be that many services available in your community. So how can you, as a community health center, advocate for integrating those within your community. Or maybe there's something that's happening in an informal setting that's supporting the mental health of this community already. So, how can we create support groups among pregnant or postpartum individuals to kind of have that um, peer support? Oops, oops. So, just some recommendations to improve screening practices. So, this is something that you can take to your health center leadership. You could take to your team. Is first we need to improve screening practices. If this is not happening at a university system with a lot more resources than a federally qualified health center, it's probably not happening. It's probably not happening. So we need to implement universal perinatal mental health screenings, which is required by law in California. I'm not sure about other states, but it would be probably good to check that. Screen during both pregnancy and postpartum visits, and use community-focused screening tools. Improve access to care. So this is also just figure out the barriers that each individual has, expand rural and mobile health care services, increase interpreter and access services, improve transportation and flexible appointment options, and strengthen systems and policies. So, like I said, in California, this is required. If it's not required in other states, perhaps you can advocate for it to be required. Provide provider and community health worker training on perimental health. Develop clear referral pathways after positive screenings, and strengthen institutional and state level screening policies. Um, I will end. I know we're a little bit going fast, but just some key takeaways that I want everyone to take away from this is that prenatal and postnatal care is essential, but access is really limited for MSAWs, especially right now. What we're seeing is people are afraid to go to health centers, especially pregnant individuals that on top of not often having availability, because, sometimes I think I even saw in the chat that people make appointments, but they're not for like another 3, 4 months. So really supporting our getting the message out there of, what services your health center provides when it comes to prenatal and postnatal care, um, including language, geographic isolation, and lack of providers really worsen these challenges. Um, but I will advocate that community health workers and local health centers, you all play a really critical role in supporting safe and accessible care and really incorporating community health workers and integrating them into your health system will support the community in mental health. I know a lot is happening within the community, and community health workers and health fairs are not really happening as much as they used to. So, really finding creative ways of how to get that message across to the community in innovative ways and creative ways, I think will really help support um, this community and the postpartum mental health care. So, that's what I have. I'm hoping that we, take a lot of questions. But I just, again, want to thank you. And this is my contact information. So I am still doing research on this, on prenatal care access and utilization among agricultural workers. So, if there's information that you want to share or some collaboration to work on something together, I'm definitely open and available. So here's my email, and yeah, thank you to NCFH, and I'm definitely open to all the questions.